Hi, I'm Marcus Plescia, the Chief Medical Officer for the Association of State and Territorial Health Officials. Testing for coronavirus, or COVID-19 as we sometimes call it, has been causing a lot of confusion lately, so we thought we would try to break it down for you. Our perspective on this is based on the testing situation in both state and local health departments. They're the ones who are doing most of the testing right now. To begin with, let's talk about 4 things about testing: the current status, who really needs a test, who does not need a test, and what to do if you're concerned about getting tested. Right now, every state health department has a supply of tests, and that's important. However, our public health laboratory system does not have the capacity to test every American, and we don't need to do that right now. The goal of testing for coronavirus is to limit exposure to coronavirus in the healthcare setting, and to make sure that those who need to get tested can do so easily without risking infection themselves. So who does need to get tested now? Basically, there are 3 priority groups of people who we need to focus our testing efforts on: healthcare workers and first responders, symptomatic older Americans and those with medical conditions, and patients whose clinicians recommend that they get tested for the coronavirus for a variety of reasons. If you're not in this group, you don't need a coronavirus test right now. Let's talk about why that is. Let's say you're not in one of these 3 groups and you feel fine. You probably don't have the coronavirus. Now, some people might have the coronavirus, but they don't have symptoms. That's what we refer to as asymptomatic carriers of the coronavirus. This is one of the main reasons why we're all practicing social distancing right now. Social distancing will prevent transmission of the coronavirus even from people who are asymptomatic. Let's say that you do have the coronavirus, but you have mild to moderate symptoms. That will be the case for most people who have the coronavirus in our communities. So if you're in that situation, you should check with your doctor about whether you need to be tested. And you should definitely be practicing social distancing, as we're all doing, to avoid transmission to others. So practicing social distancing is the case whether you're tested or not. That's why state and local health officials are urging individuals to limit large gatherings, maintain a distance of 6 feet if you're in contact with others, wipe down surfaces, and wash your hands, and prepare for interruptions in the way we usually live our lives. Social distancing works. We've used it here in the United States in the past very successfully for other epidemics like the influenza virus, and we've seen it work to control coronavirus in other countries in the world. If we've learned anything from the outbreaks overseas, we've learned that early implementation of social distancing measures can have a significant impact on slowing the spread of the disease and allowing the healthcare system to ramp up to treat severe cases. So practicing social distancing is what we need to do right now, not get everyone tested. You may have noted that the entire effort to prevent transmission of this virus now rests on individual Americans practicing social distancing. This is the case whether you get tested or not and whether you have symptoms or not. The virus is now in American communities across the country. While further testing will certainly confirm this, we know this to be the case today. We know that we have community transmission, and that's why we're beginning to start acting the way that we are. This means, again, quite simply, if you are sick, stay at home. If you're not sick, still limit your exposures and contact with other people. Again, that's what social distancing is all about. It's okay to be worried. We all are. Many people want to get tested because they just want to know if they have the coronavirus or not. I get it. We all like to have all the information we can to help reassure us. Right now, there is not a lot we know about coronavirus, and that's very scary. But there are other things you can do besides getting tested that can help reduce worry and anxiety that you or your loved ones might be experiencing right now. First, stay informed. Make sure you know the current guidance for your local and state health agencies and that you follow that guidance. Second, practice healthy behavior that will limit the possibility that you will get coronavirus. This includes washing your hands, wiping down surfaces in your home or other areas that you come in frequent contact with. Third, Stay connected with friends and family and develop a circle of support that you can rely on and share your concerns with. We hope this basic overview of coronavirus testing and social distancing has been helpful to you. If you have further questions, you can find many resources on the webpage of your state public health department or the federal website, cdc.gov. Thank you.